Hello everyone and welcome to Mountain Lake Journal. I'm Tom Helling. New York is the only state in the nation where volunteer fire departments aren't allowed to bill patients for the emergency care their ambulances and EMS crews give to those patients on their way to the hospital. Fire officials from across the state came to the Altona Fire Station to meet up with North Country Assemblyman Billy Jones and call for state lawmakers to back the Fair Play Ambulance Costs Recovery Act.
Every fire department in this state benefits from this bill.
The Altona Fire Department says 2/3 of its budget goes to pay for their EMS ambulance services and the care they give patients getting them to the hospital. The remaining third is what's left to pay for everything else.
Because of the cost of providing ambulance services to the citizens, our budgets are strained and threadbare. So any relief that we could have through the potential to bill for services rendered would be a godsend.
Insurance providers can be billed for a patient who is served by a private ambulance service, but in New York, fire departments can't pass those costs on to the patients. Fire districts and their taxpayers end up footing the bill for ambulance services. Assemblyman Billy Jones says the bill would allow fire departments to change that and charge for the ambulance services they provide.
All this bill does is it eliminates the prohibition behind volunteer fire departments billing for ambulatory services. It's as simple as that. It sounds simple, but it's been a hell of a journey for a lot of these people up here to get this through to the finish line. And we do have momentum, and we're working on it. But this bill means a lot to not only volunteer fire departments, and it does mean a lot to them, but it should mean a lot to your neighbors and your community members. Because without this, we could face the possibility someday of no one responding to a call, no one being on the other end of that call to get our loved ones the medical care that they need in their most desperate time of need. We do not want that. We never want to see that happen. And without being able to recoup some of their costs, then they have to go to the taxpayer for that. So this is a money-saving bill for our taxpayers, but above all, it's a health and safety bill for our community members.
And with the majority of their funding going toward ambulance services, there's little left for the costs needed at the firehouse, like new equipment.
And we've got several pieces of equipment that are aging, that are obsolete, that need to be replaced, but because over 2/3 of our budget cannot be recouped by the actual user of the service, we're stuck in a holding pattern in regards to replacing those pieces of equipment.
By far and away, this is a health and safety bill. This is a community caring bill. This will help our community members out. It will help our volunteers out that put in long, hard hours for us. Our volunteer fire departments. It'll recoup some of their costs. It'll help municipalities and towns and taxpayers.
Jones and fire officials say every other state in the nation has this policy.